Hello, everyone. Welcome to WVU Walk with the Future Doc. I'm glad we get so many people here today, especially some new faces. That's always great. My name is Michael Sutton. I'm a first-year medical student here at WVU. I'll introduce our speaker here in a minute, but first, just a few things to get out of the way. So you all should have gotten the notification that this meeting is being recorded. Now, we don't do anything with the video. It's just the audio that we use, but we upload the audio recordings to our YouTube channel called WVU Walk with the Future Doc. And there you can find a lot of the recordings from our past walks. So yeah, feel free to check this out. We also have a Facebook page called WVU Walk with the Future Doc. And well, we're currently scheduling for next semester, but as we get those speakers in place, we'll certainly populate that Facebook page with some useful information for next semester. Yeah, I think that's all the out of the way. So now I can introduce our speaker, Dr. Kendra Unger. She is a family medicine physician here at WVU in Morgantown. And well, as a family medicine physician, she does a lot of the things that you would expect a family medicine physician to do, but she also happens to be a board certified acupuncturist. And she uses acupuncture in her practice to treat many of her patients. So yeah, I'm really excited to hear from Dr. Unger about this unique and interesting topic. First, she'll be giving us like a brief introduction to the topic, and then afterwards, you all will have a chance to pose questions to her. So yeah, I guess that's it. So with that, I'll hand it over to you, Dr. Unger.
So I want to thank everyone for inviting me for today. Great honor, and I love walking, especially in the car. As I told you, I'm a family physician for medicine. I work right and medicine practice. So,
Dr. Unger, your audio is a bit stuffed. We can't hear you very well.
Is that better?
Yeah, I can agree with that. Yes, that is better.
Okay. And so I work as a family medicine physician, as I typically would, but I also, do a lot of hospital work as well as inpatient. And part of my practice, I do medical acupuncture. And so a lot of patients and students ask me about medical acupuncture because it's not something that you often see in your training. And so basically what I use medical acupuncture for are things that help the patient recover from pain or other emotional stressors that are triggered by neurotransmitter release. And so students always ask me, well, what is it? And how does it work? And then I ask them, well, how much time do you have? Because it's a very complex treatment modality. But basically what acupuncture is the insertion of needles into the body in specific places where we know that it will be helpful. Whenever we insert these needles, it influences the neurotransmitters in our brain and in our spinal cord to help with pain or other problems like depression and anxiety. I would say the most frequent patient that I see in my acupuncture clinic would be patients with chronic low back pain or headaches. But I also see a lot of patients for depression, anxiety. And as of late, I've been seeing a lot of patients who are interested in infertility treatment. So like females who are struggling with female infertility for unknown cause. We've been pretty successful with treating that as well. And so it's a lot of fun. Medical students often enjoy rotating with me because it's pretty easy to learn how to put in a needle. And so once we give you a little bit of training on that, you can just help me do my procedures all afternoon. So the door is open to you if you ever want to stop by and learn more about medical acupuncture. There is a board certification process in the United States, and there is also a national organization that monitors the skill and the certification process. I am happy to entertain any questions at this time, or we could talk about anything else you want to talk about, because I imagine there'll be a lot of questions.
Hold on. Do we have any questions in chat? No, not yet. So
Okay.
if you have a question, you guys can just unmute yourselves and ask away, or you can type it in the chat if you like. Oh, we just got one. One sec. So we have a question from Judy and Stan Cohen, who are asking, what is your success rate with carpal tunnel?
Oh, carpal tunnel. That's a really great question. Carpal tunnel responds very well to medical acupuncture. And in the last few years, one of my favorite studies that's been done recently was on carpal tunnel. One of the authors, Dr. Audette, works out of Harvard, and they took a look at carpal tunnel and how the pain of carpal tunnel actually imprints on the brain. So it was a very interesting study with using acupuncture and functional MRI, actually. So we see that the success rate is very high. We know that it changes the communication within the nerve involved, the median nerve, and we know that it actually changes the neuroplasticity in the brain. So with functional MRI and the use of acupuncture, this was one of the landmark studies that was done in the last few years, using functional MRI to show us what part of the brain communicates with the body and how acupuncture influences that. So carpal tunnel can be successfully treated with acupuncture. Now, once the carpal tunnel becomes severe and the tunnel is very, very narrow, of course, we would then recommend surgery. And so a lot of times we don't recommend acupuncture alone. We recommend it in addition to other treatments that we're aware of. And so we would certainly, recommend continued splinting of that carpal tunnel, as well as possible injection to help alongside acupuncture. But it has been very successful in treatment of that.
All right, thank you. That's very interesting. We have a question from Garrett Volk, who is asking, how frequently can a patient undergo medical acupuncture?
So medical acupuncture can be done as frequently or as less frequently, I guess, as the patient requires. And so a lot of times, by the time I'm meeting a patient, they have a chronic medical condition, unfortunately, because acupuncture is not something that a lot of physicians here think of as first line, and they really should. But a lot of times, if I'm seeing a patient with a chronic disease, like let's say chronic low back pain, it took many years for this condition to develop. And so it's going to take a little bit of time to fix it. So I usually talk with patients about the frequency of acupuncture as I would the frequency of physical therapy, let's say. So I usually recommend acupuncture once a week for 6 weeks to tackle a chronic problem. And then we start spreading it out. So ideally, I would like to see someone with a chronic disease process once every quarter. So maybe 3 or 4 times a year for maintenance once we get the problem under control. Now, sometimes people will have a flare of a chronic problem, and in which case I would bring them into the office weekly at that point until the flare is taken care of. But otherwise, 6 treatments back to back up front, and then spread them out as the patient tolerates. I do have some people who come about once a month for mood issues or other problems. So it's really up to the patient and how they progress.
Okay. We also have another question from Ashley Hancox, who is asking, understanding that it might only scratch the surface, but can you go a little bit into the science behind how it works? And
sure.
This to me, I mean, if I could just sort of piggyback on Ashley's question, with carpal tunnel, I presume acupuncture is not actually helping to widen the carpal tunnel. It's just sort of, if you pardon the pun, rewiring the median nerve, right, to make it a bit less sensitive.
Yes,
so
that's a great question. And this is a question that I get a lot. And so whenever you insert a needle into the skin or the subcutaneous tissue or into the muscle, that is a noxious stimulus. It doesn't belong there, right? It's a foreign substance, and the body the body recognizes it as let's say an injury. Immediately, that needle speaks to the dorsal horn of the spinal cord, and you get release of neurotransmitters that shut down the pain response. So inhibitory transmitters like GABA and substance P. You also get release in the neurocord of opioids. And so pretty quickly after the insertion of a needle, you get relief of the pain or the sensation in the area where the needle is located. So you shut down the pain response and you increase opioid release. So within minutes of placing that needle, the patient gets relief. Now, there are other communications that happen up in the higher brain centers. You can imagine the cortex, the amygdala, some of the other parts of the brain that are responsible for processing pain also recognize the needle. And then you get release of other neurotransmitters that are great, like serotonin, norepinephrine, and dopamine. And so if you think about what we do in Western medicine to treat pain, we use gabapentin, which affects GABA, right? We use NSAIDs, which affect inflammation. We use antidepressants, SSRIs, SNRIs. So basically, I'm encouraging the body to release these really good neurotransmitters without using a medication. So I hope that helps you compare what we're doing with the needles with what I would do as a physician otherwise with medication. That in a nutshell is how it works. Now, there are many, many other neuro pathways and other ways that it works. For example, inserting a needle into the muscle and manipulating it can actually encourage that muscle to relax and let go of tight knots and trigger points. And so you might have heard of dry needling that some physical therapists are doing. They're essentially doing trigger point deactivation that a medical acupuncturist would be doing. And so there are mechanical release, myofascial release techniques that we do, but then we also manipulate the neurotransmitters in the spinal cord and the brain, much like we would with medication. Does that help?
Good. Thank you. Yes. Yes. So I guess what I can sort of draw from that is that the use of medical acupuncture is not like this unprecedented means of treating disease that's completely different from anything else. It's just stimulating those neurotransmitters without medication. And we have a couple questions in chat, but the one I want to go to next is from Sarah, who asks, how frequently are patients skeptical that acupuncture can actually help them, because it does seem so different from anything else?
So that's a great question too. I see a wide range of patients, from patients who absolutely have had acupuncture before and believe that it's awesome, and then patients who come to see me and they're actually, it's kind of fun when you meet that patient who says, I'm here, but I don't believe in this. And so a lot of patients are skeptical, but the type of patient that I see is often been sick for a very long time, right? They've had chronic back pain for a long time. They've had chronic headaches, and they're coming to see me as a last ditch effort. And so there have actually been studies done on the perception of whether or not acupuncture is going to work and whether or not the patient gets better. And what we found is it doesn't matter what their perception is or what their thoughts are, they still get better. There are some patients who are just non-responders. They lack a certain enzyme. I believe it's called CCK, not the one that talks to the gallbladder, but a different one. And there are some people who just don't respond to medical acupuncture. But for the most part, people who come to my office are truly wanting to get better, right? These are the people who've been through it. They've been to the pain clinic, they've worked with their doctors. And so they're coming to me and they're asking for another modality. So some people run into the office and say, I've had acupuncture before, it's great, let's do it. And I don't have to convince them. But I do have other patients who really are questioning whether or not it will work. And with those patients, we just do a lot of education. We do a lot of follow-up and feedback on how it's going, and we just work through it.
Thank you. I think that's really fascinating. I would commend those patients that are initially skeptical of acupuncture for trying it, because that means that they really are willing to go to any means necessary to improve their health. So that's really great. I think I had another question in chat. Oh yes, from Dr. Neal. And well, you, Dr. Unger, you commented a bit about you treat a lot of different types of patients, but what about pediatric patients? So Dr. Neal is asking the age of the youngest patient you've treated and what was their diagnosis, and just about the general use of acupuncture in pediatric patients.
Sure. Thanks, Dr. Neal. It's good to see you out walking today. So now that question is, what's the youngest pediatric patient I've treated? So I won't talk about my children in that group. So officially in the clinic, the youngest patient that I have personally had in my clinic is 9 years old. I had a 9-year-old boy come in due to extreme anxiety. He is in the band and he would play his trumpet, but it would make him so nervous that he was going to miss a note that he would actually throw up. He would get so nervous and so anxious. So then he started avoiding band and he avoided school and he started doing all these avoidance things. So his mother brought him to me because she didn't really want to put him on medication. And she understood that this was a behavioral issue. So very smart mom. So I talked with the patient and he really wanted to try acupuncture, and he did beautifully. So he completely recovered from his anxiety. We did use some dissolvable Zofran for him in case he got really nauseous and he could quickly use that. So we combined some Western techniques with some acupuncture, and he did great. He ended up coming to see me about 2 years after that for some increased anxiety. We got it under control. So really a 9-year-old for some anxiety. I've also had a lot of teenagers come in with like chronic pain issues or other mental health issues. Now my kids love acupuncture, and my daughter, she has a hard time going to sleep. And so there is an insomnia cocktail that I like to do with the needles, and she absolutely loves it. So there is no lower age where you can start doing acupuncture. Now in newborns and brand new babies, their nervous systems aren't developed, right? And so you have to be almost trying to miss the area of acupuncture that you want to use for these kiddos. There's a Japanese technique called shonishin, which is a acupressure tactile type of treatment that I feel is better for newborns because you're not actually puncturing the skin. You're not entering the structures. They're so small that I would actually recommend shonishin for them. We do have a medical acupuncturist who is a pediatrician in the WVU system. Her name is Dr. Audra Rouster, and she is a pediatric gastroenterologist within the Department of Pediatrics. And she frequently treats children with gastrointestinal problems, but she will see other patients as well. And so children absolutely respond to it. You would think that kids would be fearful, but they're much more open to it than adults are. And so my kids love the acupuncture. They come to me for different things. My older daughter has some neck pain and musculoskeletal issues because she's a runner. And so we deal with those together. So kids absolutely do great.
Okay. It's friendly for all ages, I guess.
Yeah.
So we have a lot of questions in chat. I think the most pertinent one to ask for now is from Teresa, who she'd like to know a little bit more about what a typical treatment plan is like. You talked a little bit about it previously, but in general, if you had to define the typical treatment plan, and especially for people that have maybe obesity or an opioid addiction, does it ever get to the point where they might need acupuncture every week, right? Indefinitely.
So a typical treatment plan, so a patient will come to the office and I will do a full assessment. So that usually starts with a complete history and physical, right? So I'm going to collect all the information about the patient, especially if I haven't met them before. And I'll do a complete physical exam, usually focused on the area that they're concerned about. And then I will design a treatment plan based on their presentation. So there are different types of acupuncture. There's neuroanatomical, which focuses on needling in areas of the anatomy that are hurting. There's traditional Chinese medicine that involves the use of the needle for its location and its indication. And then there are other subspecialties of acupuncture, like there is auricular acupuncture that involves just the ear. You can treat an entire body system with just the ear. There's hand acupuncture as well. And so depending on the patient's presentation, I will then decide which modality I think works best. Like for now, you may have heard of the NADA protocol, which is a protocol for the ear for substance use disorder, that anyone trained to apply those needles can do so. So a patient with substance disorder can have their parole officer, their nurse, their transporting police officer, anyone who has been trained can apply that and help them with their withdrawal. So the state of West Virginia is starting to acknowledge auricular acupuncture as a really good way to help patients with substance use disorder. But that's a side issue. And so I do the evaluation just like I would any other patient. And I see them back as frequently as I feel they need and as they feel they need. Just like, let's say you have a patient with low back pain who goes to the pain clinic. Well, a similar thing happens there. The anesthesiologist does an evaluation, decides how often they need injections and where they need them, and then they follow up with them and see how it worked. That's basically how we do that. So I design their treatment plan based on their presentation and based on how I think that they will do. And we can change that treatment plan in real time based on how it's working or how it's not working.
Okay. It sounds like a very, I guess, flexible procedure that each, I guess, different technique would apply to different issues. And speaking of different issues, and this is something that I'm also very curious about, we have a couple people asking about acupuncture being able to use to treat infertility. And we're all kind of curious because infertility, of course, a lot of different underlying causes. And surely acupuncture wouldn't solve infertility in every case. But as far as acupuncture being able to treat infertility, if I could pool all of our questions together, how is it able to work? And what is the underlying root cause of the infertility that acupuncture solves?
That's a great question. And so whenever I'm seeing a patient with infertility, it's often because the infertility specialist has asked them to come see me. Here at WVU, we have the Center for Reproductive Medicine. Dr. Rowan is one of the physicians there, and he and I work together on these cases, and he often refers these patients to me. So whenever they begin their infertility workup, of course, they're going to see the physician over at the Center for Reproductive Medicine, and they're going to have some easy fixes rolled out, right? So they're going to look for hormonal imbalances, and they may also go ahead and do a scope into the uterus to make sure that the tubes are patent and that the eggs can actually move down. So they have already had that basic workup, but we all know those patients who just have trouble ovulating, or for whatever reason, they just aren't getting pregnant. We also acknowledge that trying to get pregnant when you can't is very, very stressful. And going through infertility treatments is also quite stressful. So when I'm seeing these patients, they have had an initial workup, and they're often on medication to help them develop follicles or go ahead and ovulate. So what my acupuncture does is it increases blood flow to the uterus. Okay, so it prepares the uterus for implantation and helps improve the lining there. And it also enhances ovulation and follicular development. So we know through our studies that acupuncture actually does that. So for example, in a patient that I had just last summer, she was having trouble developing follicles for harvest. And so Dr. Rowan sent her to us, and we were able to get her quite a bit of follicular development so that they could then harvest them for implantation. And so we can't fix structural problems, right? But we can help enhance the treatment. I almost always use needle placement for anxiety that goes along with this treatment. And a lot of times these patients report to me that the process is a lot less stressful and that they feel very relaxed when they leave the office. And so these are just things to help with. I do know of a very cute little 8-month-old that I see in my clinic who is a direct result of our work together with the CRM. And we've had some other success stories as well. I hope that helps too. But you're right, it's not going to fix an anatomical problem, but it can help with the implantation process and with follicular development.
Okay. Sounds good. That's certainly something I'll be telling people, did you know? And then I'll sound really smart for saying that acupuncture can treat fertility, because that is not what I would have expected for sure. I think we have a few more questions in chat. I think we'll go to Anthony, who's his question is, have you used acupuncture on MS patients for pain and tingling in the joints?
Yes, I have. I have several patients who have MS who have come to me to help with their symptoms. And so we can't fix the MS, right? And so when I see these patients, we have to have a pretty good discussion about their disease process and the things that I can help with. But a lot of times, MS patients have trouble with, like you mentioned, numbness and tingling in the extremities. Acupuncture is definitely helpful for neuropathies. They also tend to have stiff, tight muscles or trouble with ambulation. Acupuncture can help release those. Sleep disturbance is another big one that I see in neurological patients. So I also see patients with Parkinson. And so we work on sleep together, mood imbalance. We work together, and I usually try to communicate pretty closely with their neurologist. And a lot of times I can gain a lot of information from both the patient and their notes from neurology as to what those other symptoms are. Because as you know, as the disease progresses, it gets harder and harder to manage some of those neuromuscular and mental health issues. So yes, I have several patients with MS and several patients with Parkinson's that we work on those symptoms together.
That's wow. I actually know someone with MS, and it's been very difficult for him, of course. But I'll have to ask him about this, whether he knows about acupuncture. So I guess due to so many of your good responses to our questions, maybe we already have some aspiring acupuncturists in chat. Ashley is asking, what is the training like to become a medical acupuncturist and maintain your certification?
So that's a good question as well. There are several training programs throughout the United States that are recognized by the American Board of Medical Acupuncture that will allow you to sit for a board exam. There are about 9 of them. And so if you go to the American Board of Medical Acupuncture online, you will see which courses are available. The course that I took was through the Helms Medical Institute through UCLA, and it was a great course, and I felt really ready to practice after that. The training is about 300 CME hours, so it's a big, big course. To put that in perspective for you, I need 50 hours every 2 years to maintain my license as a doctor. So it's 300, and it's packed into about 9 months of training. That includes literature review, home study, and then hands-on needling experience, and then ultimately treatment of real patients. So it's a really awesome course. It also helped me be a better physician altogether. It enhanced my listening skills, my physical exam skills, and my patient assessment skills. So that is the process to start your acupuncture journey. If you wish to sit for a board exam, you are then eligible to do so once you've completed one of those training programs. Now, here in West Virginia, you are able to practice medical acupuncture under your medical license. So once you've done the course and you feel proficient in needling, you may do so. That is covered under your medical license. There is an organization called the American Academy of Medical Acupuncture, and this is the organization that monitors your certification process. You can also become a fellow within this organization, which means that you have done some teaching and you are a skilled acupuncturist. So there are a lot of fun ways to get involved, and there are physicians all throughout the country who practice. I know anesthesiologists, pediatricians, neurologists, psychiatrists. I mean, you name it. You name the specialty, I've met them. And so it's a really fun journey. And depending on what state you're in, some require certification, others do not. Here at WVU Medicine, we do ask that you complete your board exam within 2 years. I think it's 2 or 4, I can't remember, of completing the course. So myself, Dr. Oreskovich, and Dr. Rouster have all completed our board certification to work for WVU Medicine.
Okay. We have a related question from Mike, who's wondering, how did you stumble across acupuncture? Did you was it in medical school that you learned about it, and from there you decided that one day you were going to become board certified? So what was, I guess, your journey in learning about it and discovering it?
Sure. Well, I was a medical student and I just absolutely loved treating patients. And I became a family medicine doctor because I loved everything. But within my first year of being an attending physician, I realized that a lot of times I was seeing patients with very chronic problems. I would send them to a specialist. They would come back on 2 other medications and their problem still wasn't resolved. And they were still functionally not functioning as well as they could. And their pain was not well controlled, or their problem was not resolved. And they had another 3 medicines on their list. And so I became, I don't know if the word is jaded, but I felt like I just needed more tools in my toolbox. I talked a lot with a colleague of mine, Dr. Gallagher, who was a chiropractor before he went to medical school, and then became a medical acupuncturist. And I saw the way that he treated patients. He treated them completely in all realms, and his patients got better. And so he and I talked quite a bit, and he started a scholarship program in our department, and he needed a physician to head that up. So I just felt the calling and I went for it. And I have never regretted it. The information that I've learned has made me a much better physician in all the aspects. In addition to all of that, my mother was diagnosed with stage 4 breast cancer when I became a physician. And here I am, a physician ready to help everyone. And my mother has a terminal diagnosis. She's still with us, by the way, and it's 14 years later, and she's doing great. But she struggled a lot with neuropathy from chemotherapy, and nothing would touch it except acupuncture. And so I had some personal reasons and I had some professional reasons why I went down this road. And I'm very pleased that I have this extra tool in my toolbox. So it was through advocacy from another physician in family medicine who taught me about this and its value. Okay. Yeah, there's this. I guess there's always a story behind why anyone decides to do acupuncture. We have
we have a question from Sandra. She's asking about children with ADD and ADHD, which of course is becoming more and more common today. And of course, a lot of children with ADD and ADHD are given medications. Some would say they're given medications prematurely, but Sandra's asking, could acupuncture be used instead of medicine so that they never have to be on medicine to control their condition?
That's a really good question too. I have seen some patients with ADHD who wish to come off of their medication. And in my experience, it has been very difficult. A lot of times, because of the nature of ADHD and how it permeates every aspect of the patient's life, it's been difficult to help treat that. I'm not entirely familiar with what the literature says about that. I do know I've read several papers on it where it has shown to be beneficial, but there's more research needed in the realm of ADHD. It seems like every paper that I've read about it says, oh, we think it can be helpful. Here's the protocol we used, but more research is needed. And so that is my answer. A lot of times patients will experience anxiety with their ADHD, obviously, because it creates difficulty in functioning. And so if we can get that under control with our acupuncture, I think they would benefit. But a lot of times, there is a fine line between behavior and ADHD. And a lot of times anxiety looks like ADHD. So you're right. Sometimes those diagnoses get confused, especially in children. And that's where a really good mental health specialist helps us delineate that. So, if they're seen by child psych and they feel like there's a big anxiety component, we might be able to control that and, not and avoid treatment for ADHD. But when someone actually has ADHD, the literature is still out on that one.
Okay. So it's still just a hypothesis at this point, but maybe showing some promise.
Yes.
Yeah, I think Mia has a question that she would like to ask. So Mia, if you'd like to go ahead.
Yeah. Hey, Dr. Unger. I have a question just about your practice in general. So what's the difference between seeing you as a medical acupuncturist and going elsewhere for treatment? Is there a difference in treatment plan or what you do or your technique? Could you talk a little bit about that?
Sure. So there are other acupuncturists out there. They are called LACs, or lay acupuncturists. These people typically have a degree, a bachelor's degree or a master's degree in some type of health field, and then they undergo training to become acupuncturists. These people are not physicians, and their practice is limited to acupuncture only. A lot of times they don't have a full grasp of neuroanatomical acupuncture because they've not had any of that training. That being said, LACs are great folks and they do some really, really good work. And the medical acupuncture community is partnering with them to move forward and talk about legislation and treatment plans. As a medical acupuncturist, what you get from us is that we have the full spectrum of treatment at our fingertips. And so if I see a patient, like let's say somebody comes in for low back pain and it's pretty bad and they're showing me some radicular symptoms, I can get an x-ray. I can try an NSAID. I can add Cymbalta. I can add gabapentin. I can give them the full true evaluation and treatment that they may need using medicine and medical acupuncture together. And so that's really nice. Sometimes I have had patients come into my clinic with red flag symptoms. They think they're coming for acupuncture and I'm seeing something that is dangerous or not okay. And that worries me. Like, how would that patient be treated in an LAC's office, right? Because they might not recognize red flag symptoms. They might not realize that something else needs to be done. I actually had a patient come in for acupuncture and he was behaving strangely. I checked his blood sugar and it was 600. So I said, no acupuncture today, let's go to the hospital. I also had another patient come in for a back pain treatment, and I laid him down and he had a big abscess on his back. So instead of doing acupuncture, we did an IND. And so by seeing a medical acupuncturist, you get the full scope of what a physician can offer for you.
Okay.
That makes a whole lot of sense. Thank you, Dr. Unger.
Sure.
Yeah, we actually have a perfect follow-up question in chat right now. The case that you're making is that acupuncture really is not certainly not the cure-all, although it can treat a wide variety of conditions. Judy and Stan are asking, are there other parts of the body or are there certain ailments that do not respond well to acupuncture?
Yes. I find that endocrine disorders are very hard to treat with medical acupuncture. We can influence the endocrine axis with our needles, and we can budge a little bit, but I have found that things like diabetes, thyroid disease, don't respond well to acupuncture. I have also tried it for other vasomotor symptoms like hypertension. So I have tried a few recommended treatments for hypertension in patients, and I find that it just doesn't sustain. I've been able to decrease systolic blood pressure by about 10 points right there in my office. But as soon as the patient goes home, it returns right back to a hypertensive state. And so things like hypertension, diabetes, thyroid disease don't respond well to the acupuncture. Now, that being said, the effects of it, though, can be mitigated. So, patients who are having insomnia or things because their thyroid is off, that can be dealt with. But ultimately, those things need monitored and treated appropriately. So yeah, endocrine, hypertension, those are tricky.
Okay. Just to piggyback on that, are there any risks to doing acupuncture? Because I think some of the disorders you were naming, you sort of implied that there isn't necessarily a risk to doing them, but just that aside from the fact that it might not cure the problem. But are there any conditions where acupuncture should not be done due to a risk to a patient?
Yes, there are risks associated with acupuncture. I feel that they're more acceptable than medication, and so do a lot of patients. But let's talk about them. So I am using a needle, right? And the needle is going through the skin. And anytime that happens, there is a risk of a skin infection. I've done thousands of acupuncture treatments, and I've never had a patient develop a skin infection because the needles are so tiny, but that is a consideration. Bleeding is a risk. Most of the time, patients don't even shed not one drop of blood. I can have 30 needles in them and there's no bleeding. But sometimes that could happen. You can also get a hematoma formation under the skin. That has happened a few times. Now, some of the serious things that could happen, obviously, if I'm working on the neck, upper back, the lungs are under there. And so consideration of where the lung is, we certainly don't want to get a needle into the lung space and cause a pneumothorax. That would be a medical emergency. The literature on that shows that acupuncture has a very minimal risk of that. But I think that's where a medical acupuncturist comes in handy because we know anatomy very well. Also, if you're doing some back work, you could get that needle very close to the spinal cord, which should be avoided. So that's also a risk. And the development of needle shock. So we all know those folks who pass out when they get their blood drawn. That certainly can happen with acupuncture. That's just an increased signaling from the sympathetic nervous system and can be easily treated. Some things that we don't do that are just frank contraindications. If someone's on blood thinner, we do not insert a needle into a closed muscle, such as the calf muscle, because that could, if there's bleeding into that muscle, you could have compartment syndrome, right? We also do not insert needles through infection. So if a patient has cellulitis, we do not place a needle through that cellulitis. We also avoid inserting needles in close to fractures, bone fractures, especially in kids, because you don't want to inhibit the the scarring of that bone or the healing of that bone. So yes, those are all very good questions. But those are mainly the risks associated.
Okay. But it sounds like the risks that are there can be mitigated through proper training and not cutting corners, making sure you're doing the correct procedure. So if those are the worst risks and they can be mitigated in that way, I can certainly see the advantages compared to using medication to treat these conditions. And we have another question from Mike, and he's wondering about bursitis. Is there any research, or have you been able to treat bursitis with acupuncture?
Oh, yes, bursitis can be treated. So I'm going to ask you all to change the way you think about inflammation today. So inflammation is not a bad thing. Inflammation is the body's way to clean up and repair something that isn't going right. It's our body's way of letting us know that something's going on. And so if you have a burn, let's say you have a burn or a scar, and you place needles around that, you are going to incite inflammation around that scar and around that burn, because the needle doesn't belong. It's going to do vasodilatation, release nitric oxide, and bring the immune system to those wounds, which is exactly what you want it to do. You want those good inflammatory markers and those fibroblasts and macrophages there to clean up that wound and that burn. The same thing is true with bursitis. So let's say you have a bursa that's inflamed. It's inflamed for a reason. And so the needles will shut down the pain response. Okay, so we'll get our GABA, we'll get our substance P, and we'll get our opioids and our, let's say, serotonin. So we'll shut down the pain response around bursitis, but then we will actually increase inflammation and help clean up the problem. And so as an acupuncturist, I don't mind a little bit of inflammation, because that means the body is trying to fix the problem, right? Now, of course, there are some conditions like rheumatoid arthritis where inflammation is really bad, and our needles can help with that too. But yes, bursitis, I see it a lot.
Okay. Let me see if we have any other questions in chat. Can't open the chat. Okay, here we go. We don't have any other questions, I don't think. There is a survey that the participants can take. If you all would like to take it, that it would really help us out, tell us, what we did well and also what we could do better. I think we have time for one more question, so I suppose I'll ask a question. Have you noticed any trends regarding, I guess, the use of acupuncture and medical opinions about acupuncture? Do you think that we're trending in the right direction with more and more people recognizing the validity and usefulness of acupuncture?
Yes. So in the last 10 years, there has been an explosion of acupuncture research. One of those reasons is because of the chronic pain epidemic that we have going on. So research into other alternatives of pain modality. Also the development of fMRI, where we can place a needle into the body and see where it goes in the brain. It has really helped with research, because we can actually delineate the neuropathways that are involved now. We used to just have to accept that it worked and move on, but now we can actually say, this is the neurotransmitter, this is the place in the brain that is speaking. And so acupuncture is becoming more and more scientific. We're able to do better research and more complete research. So it's becoming more acceptable. We're also showing that it works. There is a journal, if you're interested, it's called Medical Acupuncture, and it is a basic science and clinical science journal that is through PubMed, and you can read that and get some information about different treatment modalities and disease processes that we have really, really good research on. So a lot of people don't realize that we do have our own journal, and that it is completely scientific and is rigorously studied. So yes, the medical community is talking to us more and more, especially because of this pain issue. And that's where a lot of colleagues are becoming aware that it is a valid and evidence-based approach to treatment.
That's great. That's excellent to hear. And with that, that's pretty much all the time that we have today. Again, I would just like to remind everyone to take that survey. Helps us out a lot. But Mia, I think Mia would like to say something.
Yeah, I just want to thank Dr. Unger for being with us today. She was my preceptor during second year, and I loved working with her. So I was so glad that she was available to talk with us today. Thank you everyone else for getting out and being active this Saturday morning. We love that you're walking with us, even if it's virtually. We love that we're reaching people from all over the place. So if you could open the chat right now, please type who you are and where you're walking from. We love to see how far this program has reached. We're trying to see how many states across the country, and honestly, how many countries we can reach across the world. So this is our last walk for 2021. So we're going to start with a fresh new program in the new year. So you can follow us on Facebook for a list of our upcoming events. And you can also pop over to our YouTube channel where you can see a list of previous walks and listen to the recordings, share them with family and friends. And as Michael mentioned in the chat, there is a survey link that Taylor posted, just getting some feedback on our walk, how you what you thought of the walk, and any ideas that you have for the spring. We would love to hear them. So thanks again, everyone, for joining us. And thanks again so much, Dr. Unger. We really appreciate you being here today. Happy holidays to everyone. Stay safe, stay warm, and we'll see you in the new year.